Ebola and new fears after a 26-year-old nurse in Dallas caught the disease. And it appears the Nebraska Medical Center's biocontainment unit might soon be in greater demand. Good evening, I'm Craig Negrelli.
And I'm Jennifer Griswold. Now a top national health official says the government should consider sending patients only to specialized containment hospitals. The director of the National Institute of Infectious Disease, Dr. Anthony Fauci, made the statement today. Hospital workers who treated Ebola patient Thomas Duncan in Dallas are being closely monitored after a nurse contracted the virus, despite wearing protective gear. As Nebraska Medical Center currently treats Ebola patient Ashoka Mukpo, they have specific procedures in place to keep staff members from becoming infected. KMTV Action 3 News reporter Josh Egbert is live at the Nebraska Medical Center with the details. Josh?
Ashoka Mukpo continues to get better every day. The Nebraska Medical Center says he is sitting up. He no longer has any nausea or vomiting and is eating some solid food. He is also even posting on Facebook and Twitter. They say they are feeling pretty good about his prognosis and care, and it's that same care that hospitals from around the country are turning to help fight this deadly virus.
We're doing as fast as we can, broadly sharing our information.
As doctors and nurses at the Nebraska Medical Center continue to care for a patient with Ebola, it's their safety procedures that are catching the eye of hospitals around the world.
It's just everyone right now is just trying to become better informed.
Shelley Sweethelm is the director of nursing for the Med Center's biocontainment unit. She says every day they're contacted about caring for patients with this deadly virus.
I think they feel very safe and confident in what they're doing, and they feel like our procedures and protocols are exactly what they need to stay safe.
Over the weekend, a nurse in Dallas tested positive for the virus. She was caring for an Ebola-stricken Liberian man who later died. Officials say she contracted the disease despite wearing extensive protective gear. Sweethelm says staying safe comes down to procedures and protocols.
We also have a single individual whose job is no other than to help somebody put on and take off their personal protective equipment each day, every moment of the day.
Sweethelm says any hospital could potentially care for an Ebola patient, but what's missing is a level of confidence and assurance in the safety process.
This is a much more advanced level of personal protective equipment that's needed, and I think just the meticulous nature of it, and again practicing it and being accountable to making sure that you have someone fully responsible to help you.
Now, the Med Center says they have not been contacted about caring for any more Ebola patients. They do talk to the CDC on a daily basis. Sweethelm says that they could take up to 3 at a time with the staff that they have. But again, there is no patients will be planned to bring any more patients to Omaha at this present time. Reporting live from the Nebraska Medical Center, Josh Egbert, KMTV Action 3 News.